Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. For many families, the birth of a baby is filled with excitement. But sometimes, newborns arrive earlier than expected or need specialized medical care immediately after birth. Inside the Neonatal Intensive Care Unit, better known as the NICU, a team of healthcare professionals works around the clock to care for some of the smallest and most fragile patients in medicine. One of the most important tools helping guide that care is medical imaging. Today, we're going behind the scenes to discover how medical imaging helps diagnose illness, monitor treatment, and support newborns during their earliest days of life. The NICU is a specialized hospital unit that provides care for newborns who require additional medical support. Some babies are born prematurely. Others may have breathing difficulties, congenital conditions, infections, or complications that require close monitoring. Because newborns can change quickly, healthcare teams rely on imaging to help answer important clinical questions while minimizing discomfort. The NICU team includes neonatologists, nurses, respiratory therapists, medical radiation technologists, sonographers, radiologists, and pediatric specialists. One of the most commonly performed imaging examinations in the NICU is the portable X-ray. Rather than transporting fragile newborns through the hospital, the imaging equipment comes directly to the bedside. Portable chest and abdominal X-rays help evaluate lung expansion, bowel gas patterns, and the position of life support equipment such as breathing tubes and central lines. These images help the healthcare team make timely decisions while keeping disruption to a minimum. Portable imaging brings care to the baby. One of the remarkable advantages of newborn anatomy is the presence of the fontanelles, often called the soft spots. These natural openings allow ultrasound waves to reach the brain without surgery or radiation. A cranial ultrasound can help evaluate the brain for bleeding, fluid buildup, or other conditions, particularly in premature infants. Because ultrasound is portable and uses sound waves, it can often be repeated safely to monitor changes over time. A cranial ultrasound uses no ionizing radiation, can be done as a bedside examination, and it shows the team real-time imaging. Some newborns require detailed evaluation of their heart. An echocardiogram uses ultrasound to create moving images of the heart and assess its chambers, valves, and blood flow. It can help identify congenital heart abnormalities and evaluate how well the heart is functioning. Because it provides real-time information without radiation, echocardiography plays a vital role in neonatal cardiac care. Although many imaging questions can be answered at the bedside, there are situations where more advanced imaging is needed. MRI provides highly detailed images of the brain and other soft tissues and may be used to evaluate certain neurological conditions or congenital abnormalities. CT scans are used less frequently in newborns but may be appropriate in selected situations when rapid imaging is required or when CT offers the most useful information. Every decision about imaging balances the potential benefits with the specific clinical needs of the infant. Newborns are especially sensitive to medical care, which is why imaging teams take extra steps to optimize every examination. For X-ray imaging, technologists use carefully selected exposure techniques, precise positioning, and quality assurance practices to obtain the diagnostic information needed while avoiding unnecessary repeat images. Every examination is performed with patient safety at the forefront. Every image is part of a larger story. Medical radiation technologists and sonographers acquire the images. Radiologists interpret them. Neonatologists combine the imaging findings with the baby's clinical condition, laboratory results, and ongoing assessment to guide treatment. Together, they form a team dedicated to providing the best possible care for every newborn. The tiniest patients often require the greatest teamwork. From portable X-rays and cranial ultrasound to echocardiography and advanced imaging, medical imaging helps healthcare teams make informed decisions during some of the most important moments in a newborn's life. Behind every image is a team committed to compassionate, evidence-based care and a family hoping for the very best. Thanks for watching In the Know Medical Imaging, where we make medical imaging easy to understand. If you enjoyed this video, please like, subscribe, and share it with someone who would find it helpful. We'll see you in the next one.